Hello everyone, I am Dr. Kriti Tiwari, IVF specialist and clinical center head, Seeds of Innocence, Malvinagar. Today we will discuss about the process of IVF. What are the steps which will take you through the process of IVF? Today we will discuss about that. So the first step in any IVF cycle is initial consultation, in which your history is taken, your initial tests are run, and a process is formulated about how the IVF cycle is about to undergo, how you are about to undergo the cycle, and what all drugs you will be given for the stimulation. It is decided on the initial consultation. During the second visit, you are called on day 2 or day 3 of your menstrual cycle, and from that day 2 or day 3 of your cycle, injections for stimulation of your ovaries are started, which are usually around 10 days long injections, and they are given on daily basis. And in between, you are called for 2 to 3 scans in which the growth of your follicles or eggs are seen. Once the eggs achieve the size of 13 to 14 mm, another injection is added, which is called as antagonist injection, to prevent the rupture of your eggs inside the body, because we want to take them outside. And then they are again followed up serially with ultrasounds till they become 17 to 18 mm in size. After that, once they are attain the size of 17 to 18 mm, we do egg pickup under anesthesia, that is called as egg retrieval, in which all your follicles are aspirated through a fine needle which is inserted through the vagina under anesthesia, and the follicles are punctured and the fluid is collected, and it is screened by the embryologist in the laboratory for eggs under the microscope. Once the eggs are collected, the husband is asked to give the semen sample in the room, and the semen is washed, processed, and the sperms are seen under the microscope, and they are kept with the eggs inside a dish to get them fertilized naturally. This is IVF. But if your sperm count is very low, or the motility is very less, or you have an unexplained infertility, so to prevent the fertilization failure, another process called as ICSI, in which each egg is fertilized with each sperm under the visualization of a microscope, is done. Then they are kept in the laboratory incubators for further growth and culture of the embryos for another 3 to 5 days, and they are periodically checked for their growth. Once they are day 3 or day 5, depending upon their growth, they are transferred back into the body inside the uterus through a fine cannula, and you wait for 2 weeks to get your results that you are pregnant or not. So this is the whole process of IVF, and I hope I have made IVF process very simpler for you, and you can undergo this journey with us. If you have any doubts regarding this process, you can put your queries and we will be happy to answer those queries. Thank you.